Hi everyone, thanks for joining me in this session. What we're going to do today is to look at psychology's response to the COVID-19 pandemic. Essentially, this is a module that is designed to look at psychology in context, and the current context is COVID-19. So what better topic to look at this week than how psychology is responding to the pandemic? You're probably wondering where all this research is coming from and how it's coming out so fast. Essentially, the normal process for getting research out involves a researcher doing a study, doing some research, writing it up, sending it to a journal, that going through 1, 2, 3, maybe 4, even sometimes rounds of revisions, and then finally it comes out in a journal. What we can do instead, though, is start putting out research earlier, so we can put them on things called preprint servers. So a preprint is essentially a paper that's been written. It's not yet been peer reviewed. It's not been looked at by other academics or other experts. But what you can do is you can put your research out there, and it can essentially allow people to exchange ideas in a kind of quicker way that is maybe less formal than the kind of rigorous peer review journal approach. Most of these papers that are on preprint servers have been either submitted to a journal for review, or they will be in the near future. But essentially what these preprint servers allow is for research to get out a lot quicker than it would have been otherwise possible. In psychology, the most commonly used preprint server is called PsyArchive. You can go to psyarchive.com and you can search for papers that are on that preprint server. I've got a few on there. I've got colleagues that have got papers on there as well. But this is where a lot of the COVID-19 research at the moment is coming out. So it's in preprint form. There's a couple of studies that have been published already, but mostly in the main, these studies are in preprint form. Now, these preprints do need to be treated with a little bit of, not necessarily skepticism, but maybe a little bit of caution. Anna Shiel has put some stuff out looking at crisis research fast and slow. So this obviously is a crisis scenario that we're in terms of the pandemic. And what this has led to is a lot of researchers trying to put research out quite quickly. So putting together research plans, research proposals, submitting them through ethics, getting their data and writing them up quite quickly. What Anne Shiel has done in this research piece that she's done is think about what some of the likely ramifications of that are. So thinking about the implications in terms of research quality, research outcomes. Some of you might have heard of the reproducibility crisis in psychology and looking at whether results are replicable or whether they are reproducible. What this research, or what this article has looked at, is whether or not this crisis research actually takes us back a little bit. So a couple of years ago, there was a big movement towards replication and reproducibility, introducing things like pre-registration. So you have your research idea, you put your plan together, you pre-register exactly what you're going to be doing, and then you do what you said you were going to do. Now, obviously, with quick research and the quick turnaround in terms of the COVID-19 research, it's quite difficult sometimes to go through all of those stages. So what Shiel was suggesting in this piece was that maybe people doing crisis research might be taking us back a little bit to pre-reproducibility times. This idea of kind of anyone who has a qualification should be eligible or entitled to do research. There's this kind of common meme of people have a PhD in psychology, they're seen as a doctor, so therefore they're taken at face value. It's not necessarily the case that we can kind of promote ourselves in that way, and it might be worth just having a little bit of caution about how you interpret some of these preprint findings. Now, in terms of what's actually been done, psychology preprints seem to be divided into 4 different groups. The first one is related to review and theory papers. So essentially what these are doing are saying, what is the likely implication of psychology, or what's the utility of psychology in the pandemic? So what can we do? What can our contribution be? What are the possible areas of research that might contribute to a better social response to the pandemic? You also got obviously mental health papers. We know that people who are going through social isolation, social distancing, at the moment there might be ramifications or implications for their mental health. So what we're doing with that is thinking about what are those likely implications and how can we maybe mitigate them. There's also things being published in relation to psychological interventions. So what can we do to encourage people to socially distance? What can we do to encourage people to maybe seek help when they experience symptoms, to distance when they experience symptoms, to wash their hands more, for example. There's a lot of kind of implications or interventions that are being designed around that, or looking at psychometric predictors of that kind of behaviour change. And then there's some research coming out more recently about socio-political responses. So what is the response of liberals and conservatives to the government response or to their behaviour change? And can we look at things in those kind of political or partisan ways? Throughout this lecture, we're going to look at each of these four areas in turn. Very briefly, a lot of the literature that is coming out we won't be able to cover, but I'll put all of the links that I can. And this is why I'm using YouTube for this lecture. I can put all the links in the description of the video. So just go to the description on YouTube and you can find all of the links that I'm talking about, and a link to SciArchive where you can search for more papers as well. Okay, this is the biggest paper so far that has come out. It's been downloaded, I think, more than 7,000 times now, looking at what is the potential utility of using social and behavioural science in this pandemic response. So what is the contribution that we can make as psychologists and as behavioural scientists to this pandemic? It was led by Jay Van Bavel from New York University, but there's a range of different people that are listed as authors on here, and each author has taken an individual section of this report and they're looking at what does their particular area of expertise have to contribute to this crisis situation. There's various different areas that are mentioned in this review article, and I would encourage you to go and read it because I think it's a really important piece. It's going to be published in Nature Human Behaviour, I believe, anytime now. But areas like decision making under conditions of stress, for example, what can we look at in terms of leadership psychology or communication around kind of scientific research and scientific findings? How can we best make sure that research evidence is getting into kind of the public's consciousness? How can we get people to take account or take notice of research articles and research findings to best facilitate behaviour change, social distancing, and stopping that spread of the virus? Obviously, things around partisanship and political polarisation is really important. We've seen in the US, for example, that the COVID-19 pandemic has been politicised quite heavily. And we'll come on to what some of that research looks at in a few minutes' time. But also mental health and coping and kind of the experience of social distancing and the experience of the pandemic itself is quite interesting from a mental health perspective. So we'll look at some of those findings as well. So yeah, various different areas of psychology that's been implicated, including all of those that I've just mentioned. Moral decision making is another one. Communication, persuasion research is kind of other areas of research that might be implicated in helping to facilitate social science having an effect in how we respond to this pandemic. Okay, looking at kind of mental health outcomes now, what we've seen is that there's various different ways in which mental health researchers have looked at this topic. So a lot of people have just said, okay, what are people's perceptions of the pandemic, perceptions of COVID-19 itself, and how does that link to their mental health outcomes? Lee and colleagues have found that in China, seeing the virus as being more severe has a negative effect on people's mental health. So the more severe you perceive the virus to be, the lower your mental health is. But that can be buffered somewhat by people's self-control. So if people have a perception that they have agency in the pandemic, if they can control the extent to which they come into contact with the virus, that has a positive effect on their well-being or their mental well-being. You've got Ammerman, which is the bottom right-hand corner on this slide, suggesting that a lot of people who are reporting suicidal ideation at the moment are directly linking that to COVID-19. So they're experiencing this kind of stressful situation. They're not necessarily having control over what they're doing at the minute. And agency is a really important mental health predictor. If you can perceive that you have agency, you can perceive that you have control over your own life, then you're much less likely to experience mental health issues. So what Ammerman and colleagues have suggested is that people who have that experience, that negative experience of COVID-19, have poorer mental health outcomes. But actually what they're seeing as well is that a lot of people who are suggesting that they have particularly poor mental health at the moment, so suicidal ideation, are actually seeing COVID-19 as a way of enacting that ideation. So they're going out and they're trying to catch COVID-19 in order to kill themselves, essentially. So that's one potential other way that people are using COVID-19 to alleviate mental health issues, or to maybe exacerbate them as well. Obviously, that's the experience of perceiving the severity of COVID-19, but you've also got things related to the experience of social isolation. So people might perceive themselves as being safe, but in the current climate, when they can't see people, they can't meet family, they can't meet friends, they might feel really lonely. And we know that loneliness is a real predictor of poor mental well-being. If you don't feel connected to other people, then you typically are more likely to experience poor mental health outcomes. So the study in the bottom right-hand corner here actually looks at the availability of mental health services. So at the moment, we know that doctor surgeries, for example, are severely limited in terms of the services that they're offering. But also mental health professionals are struggling to provide the same level of service that they previously would have done. And obviously that has a massive implication for people who have poor mental health trying to access the support that they might need at the moment. Now, this idea of connection is really important, and there's two recent books that I really want to kind of suggest to you if you are interested in this. Johan Hari's book looks at kind of other causes of depression. In previous lectures on this module, we've looked at Johan Hari's ideas of connections and how lost connections are a predictor of depression, for example, but also how gaining connections is a good way of alleviating depressive symptoms. There's also a new book, it only came out last week, called Transcend by Scott Barry Kaufman. And what he is suggesting is that connection is a core human need. So it forms the basis of people seeking self-actualization. And if you don't have that connection, then you're less likely to have things like good self-esteem, you're less likely to feel secure in your life, and then you're less likely to have the confidence to navigate that social environment, to seek higher achievements, higher experiences. So they're two really good books. If you are kind of struggling for things to read at the moment, there are two really good books, I think, that can help you to understand the value of social connection, particularly at the moment. Other people have looked at mental health outcomes in terms of fear of COVID-19. So Horsu and colleagues have looked at developing a scale that looks specifically at the fear of COVID-19. And they said a couple of quite important things. So they said that people with high levels of fear potentially aren't thinking clearly or rationally. And they said that we need to, as scientists, develop ways to alleviate this kind of level of public fear. Now, this is a really important point, because we do know that people from a social cognitive perspective, when they're experiencing high levels of emotion, they really do struggle to make decisions that are rational, or what we would perceive as being rational. But in some situations, having an experience of emotion, particularly fear, could potentially be normal or even functional. That was one idea that I had with a couple of colleagues of mine. So we quickly designed a study to look at this, to see whether people experiencing high levels of fear about COVID-19 actually made better decisions in terms of their pandemic-related behaviour. So things like increased hand washing, social distancing, sharing messages that are public health promoting on social media and things like that. And what we found was that for a range of different political variables. So we initially wanted to look at political variables in terms of ideology or moral foundations, and we've looked at those already in the module as well. What we thought was that they might be driving behavior change. So if you have a particularly high emphasis on the care foundation, for example, if you care for other people, you might change your behavior, because you changing your behavior has an impact on the well-being and the health of other people. Similarly, for the Purity Foundation, if you place moral emphasis on purity and avoiding pathogens, then you might be more likely to change your behaviour to avoid COVID-19? What we found was that none of those variables had an impact on behaviour change at all. Instead, what we found was that fear of COVID-19 was the thing that was driving behaviour change in a positive direction. So the more fearful you were of COVID-19, the more you were changing your behaviour to follow government advice, to follow public health advice. So what this is suggestive of is that fear in certain situations is a functional emotion, or anxiety is a functional emotion, because this particular measure might be more tapping into anxiety than it is to fear. Other people have looked at how they might manipulate people in terms of helping them to follow government advice, to follow public health behavioural advice in relation to stopping the spread of COVID-19. This was one of the first studies to come out by Jim Everett and colleagues. And what they suggested was that people who were given a deontological public health message, so a message that suggests that behaviour change is your duty, rather than a utilitarian one, which is about thinking about the effects of your behaviour on other people. That deontological argument, or that deontological message, seemed to have a much better effect on both self-reported behaviour change, but also the second order beliefs about how well the messaging might work for other people as well. There is a little bit of a caveat to this, in that when you correct the p-values for a number of different corrections that they've made, or a number of different comparisons that they've made, these results don't stand up in terms of their statistical significance, but it still might be suggestive of the fact that certain types of messaging around the COVID-19 pandemic could be more effective than others. So if you're saying to people that you should change your behaviour because that's the right thing to do, that's a moral virtue based message, potentially that's going to have less of an impact than saying it's your duty to do that. So if you think back to the war, for example, you have that kind of poster of your country needs you, it's your duty to sign up to the army. This is the same kind of message. It's your duty to help in this fight against COVID-19. And if that is the message that you're receiving, according to this data, you're more likely to change your behaviour as a result of that. There's been other research that's been published looking at attitudes and perceptions about COVID-19 itself. So Gordon Pennycook and David Rand have been leading on some of this research. They've looked at attitudes and perceptions and fake news in a range of different scenarios now. What they were looking at here was measures of political ideology. So are liberals and conservatives different in terms of how they view COVID-19? But they were also looking at cognitive sophistication. So they were looking at things like the cognitive reflection task. So for example, if I said to you, you spend £1.10 on a bat and a ball, the bat costs exactly £1 more than the ball. How much does the ball cost? The intuitive answer is 10p, but actually the right answer is is 5p. Sorry. So because you have a 5p ball and a £1 5p bat, the bat is exactly £1 more than the ball is. This cognitive reflection test looks at how likely you are to overcome some of your intuitive responses. So if you have an intuitive response, so for example, the ball is 10p, that's the incorrect answer, but intuitively it feels like it's the right answer. How likely are you to overcome that intuition and reflect cognitively on what your answer is before you give an answer? That's one measure of cognitive sophistication. There's also a measure of general science knowledge and something called bullshit receptivity. So this idea of you have a profound, or what looks like a profound statement. How much do you think that has some kind of deeper meaning? And if you perceive these kind of nonsense, pseudo-profound statements as having some kind of deeper meaning, then according to Pennycook and colleagues, you're more receptive to bullshit. In terms of what they actually found, they saw relationships between conservatism, so this column here, and things like cognitive sophistication. So conservatives in Canada and in the UK and in the USA were less cognitively sophisticated They also had higher levels of misperceptions about COVID-19, so they were more likely to believe myths about it. They were less likely to change their behaviour. That's number 5. The exception to that is in the UK, which actually maps onto the research that I did with Liam Satchell and Rob Latzman and Dean Fido. And they were less likely to see COVID-19 as being a risk. They were also looking at the effects of cognitive sophistication on perceptions about COVID-19. So the higher your cognitive sophistication, the less likely you were to endorse misperceptions or myths about the virus. And essentially what they're looking at is there an interaction between these two things? So is there an interaction between your politics and the way that you process information and how you think about COVID-19? I wrote this down by country. So in Canada, what they found was that conservatives were much less likely to have accurate beliefs about COVID-19. So the more conservative you are, the more misperceptions you had. The more conservative you are, the less risky you thought COVID-19 was. The more conservative you are, the less you change your behaviour. And the more conservative you are, the less you agree with the government leadership on COVID-19. This is important because in Canada they have a liberal government. In terms of cognitive sophistication, though, all they found was that there was an effect in misperceptions. So the less sophisticated you are cognitively, the more likely you are to have misperceptions about COVID-19. In the UK, conservatism was associated with better perceptions of the leadership, obviously not surprising given that Boris Johnson is a Conservative Prime Minister, but also cognitive sophistication, similar to Canada, was associated with higher levels or lower levels, of accuracy. So the more sophisticated you are, the less likely you are to have misperceptions, or the more likely you are to be accurate in your judgments. In terms of the USA, what we see is a similar trend to Canada. So the more conservative you are, the less accurate you are. So the more misperceptions you have, the lower the risk of COVID-19 you perceive, the less you change your behaviour, and the better you see the government as doing. And the more sophisticated you are, the fewer number of misperceptions you hold. So this is again saying the more intuitively you think, the more likely you are to have misperceptions about COVID-19. This is a study that was put forward by Matthew Stanley and colleagues, again testing this idea of cognitive reflection and following government advice in terms of socially distancing and changing behaviour. What they found was that there was a direct effect or a direct positive relationship between cognitive reflection and following advice. So the more cognitively sophisticated you were, the more likely you were to consider government advice and change your behaviour. But that relationship wasn't significant. It wasn't statistically significant. But what they thought was that maybe there's some kind of interaction between your style of processing, your style of thinking, and whether you believe COVID-19 is a hoax or not. Do you actually believe that it's a thing? Do you believe that this pandemic is a real thing, or is it something that's manipulated by someone else? And what they found was that there was a negative relationship between analytical thinking and seeing COVID-19 as a hoax. So, for example, what that means essentially is that the less analytical your thinking style is, the more likely you are to see COVID-19 as being a hoax. And the more likely you are to see the higher level of hoax thinking, the more you think it is a hoax, the less likely you are to engage in government advice or to change your behaviour. That indirect effect, so if we just change that around so it makes more sense, the lower your cognitive reflection, the higher your intuitive thinking is, the more likely you are to see COVID-19 as being a hoax. Relationship between hoax thinking and following advice is negative, and that's the route by which cognitive reflection leads to behaviour change or a lack of behaviour change. So the lower your cognitive sophistication, the more likely you are to see COVID-19 as being a hoax, and then the less likely you are to change your behaviour. Pennycook and Rand again have looked at misinformation and the sharing of fake news. And what they found is that people are quite good at discerning true news from fake news in terms of the accuracy that they have. So if you just present someone with a fake news headline and a real news headline and ask them how accurate is this information, they can discern fake news from true news. But in terms of whether you ask someone if they're going to share a particular headline, there's no difference between true news and fake news. People are equally likely to share fake news about COVID-19 than they are to share real news. Now, that's a real issue because what that means is that fake news ideas or conspiratorial thinking is equally likely to be shared on social media, and it's more likely to have a platform on those websites. What Pennycook and Rand found was that it's this kind of cognitive reflection that seems to be driving some of those behaviours. So, for example, the less sophisticated you are from a cognitive perspective, the more likely you are to share both fake news and real news. So the more intuitive you are in your style of thinking, the more impulsive you are essentially in terms of sharing news. In a second, that was whether or not people would be likely to share these both accuracy and sharing these fake news or real news items, either after seeing a prompt about checking the accuracy of these stories. So you'd have an accuracy nudge about, we want you to consider before you make a decision whether or not this is a fake news headline or a real news headline. What they found was that in the control condition, so that's this one here, no real difference in terms of people's likelihood to share either real news or fake news. So when you don't ask people to think about the accuracy of a news item, they're equally likely to share real news and fake news. If we just take that away, and then we look at the treatment condition, which is where they had an accuracy nudge, so they were asked to consider the accuracy of a news story before making a judgment about sharing it. People were much more likely to share a true news story than they were a fake news story, just by having this initial prompt about considering the accuracy. So bearing in mind that we know people can discern true news from fake news, they can tell that some stories are accurate and some stories are fake. Having people consider that before they share can potentially have a positive impact on the amount of fake news that is shared. They also looked at discernibility, I suppose, in terms of the effects of having that prompt on fake news and real news sharing. What they found was that true news was shared more and fake news was shared less. So this is a measure here of the effect on sharing. So fake news being shared less, having a negative effect size, and true news being shared more, having a positive effect size. So again, this is just showing how these kind of very subtle prompts or nudges in the direction of considering accuracy can have quite a nice effect in terms of having less fake news shared. This is a study that was published by Tom Popinski on his website, looking at partisanship and health attitudes and behaviours. What they found was that essentially Democrats, as opposed to Republicans, so we might see them as being liberals as opposed to conservatives, were more likely to change their behaviour. So that's this one here. If there's no difference between Democrats and Republicans, then we would see these lines overlapping with the midpoint. But what we see is that Democrats typically are changing their behaviour more than Republicans. And we see a much bigger effect than that in terms of people's attitudes. So that's this one just here, sorry. So big effects of partisanship on people's attitudes about COVID-19 and about the government response. This is really where we see partisanship happening in terms of political responses. We've seen various different people in the US try to politicise the COVID-19 crisis. We've seen President Trump do it. We've seen people on the left do it as well in terms of criticising the response to COVID-19. And this is really where you see that kind of pulling apart of people in relation to their political ideology. And what we're seeing is that people who are not supportive of the power in government, of the people in government, more likely to change their behaviour, and people who are more supportive of the government party being less likely to change their behaviour. So it seems like it may be a motivated approach going on here. So there's a motivation process going on in terms of changing behaviour or not changing your behaviour in accordance with what side of the politics you support. Again, this is another study looking at potential effects of support for messages as a function of who is saying that message. What we see is that Republicans are less likely to support a health promotion message when it's coming from a Democratic politician than they are from a Republican politician. But you see a symmetry in Democrat voters in terms of they're less likely to support a health promotion message when it comes from a Republican than they are a Democrat. So you see that people are judging information in a way that is motivated by the source of that information. Is this someone that is part of my in-group, or is it someone who's part of my out-group? If it's a member of my in-group, I'll believe it, I'll support it. If it's a member of my out-group, then I'm not going to believe it and I'm not going to support it. So there's a symmetry between Democrats and Republicans in terms of how they're interpreting some of these messages. Okay, so in summary, it seems as though behavioural science, social science can help us to understand a range of different issues in relation to the pandemic. We've touched on some of them in terms of understanding mental health responses, in terms of looking at people's behavioural responses. Are there certain ways that we can encourage people to engage in behaviour change? Can we facilitate some kind of functional fear, maybe? Instead of having people just scared out of their wits, can we produce an anxiety response that motivates productive or positive behaviour change? In terms of socio-political research, it does seem as though we're looking at politics as usual. So we see that partisan divide in terms of liberals and conservatives, at least in the US. We don't see it that much in the UK. And it might be something quite unique to the US political context that is leading to a range of different kind of polarizing effects, particularly in relation to COVID-19 and the government response to that. If you want more resources on COVID-19, I've been a real big fan in the last couple of weeks of Brett Weinstein's podcast on YouTube. He's been sitting down with Heather Heying, who is an evolutionary biologist, looking at responses to COVID-19, looking at some of the preprints in the science of COVID-19. So it might be something that you're interested in, just sitting down and watching a couple of those so you can find out some more information. Hopefully you've enjoyed this kind of format of presenting as well. I'm planning on doing more stuff like this in terms of putting lectures out like this, because I can put all of the resources in one place. You've got the link just in one place. You've got all of the resources in the description. Hopefully this makes sense. So if you do like this, then do keep an eye for more stuff coming out soon. If you have any questions, you can ask them in the same kind of places. So email, Twitter, discussion boards on the module learning room if you've got access to those. Hopefully you're keeping well, keeping safe. If you do have any issues, then do let me know. Okay, thanks.